Good afternoon. My name is Tom Harper. I'm going to be your moderator for this training exercise. So today we are going to be talking about health literacy, the patient experience. So the learning objectives to describe what health literacy is and how it affects our institution, to help patients remember how and when to take their medications, and lastly, to encourage patients to ask questions. So to effectively communicate, we must realize that we are all different in the way we perceive the world and use this understanding as a guide to our communication with others. So health literacy is the degree to which individuals can obtain, process, and understand the basic health information and services they need to make appropriate healthcare decisions. Nearly half of all American adults, roughly 90 million, have difficulty understanding and using health information. Patients with limited health literacy have a higher rate of hospitalizations and use of emergency services. At the same time, health-related decisions are becoming more complex. Rising healthcare costs and prevalence of chronic healthcare diseases and unlimited access to health information on the internet are creating a shift toward a more consumer-driven healthcare. Patients are the primary decision makers of the healthcare they receive. So during this training workshop, we are going to work on two areas of concerns and look at the strategies to create a patient-centered care process that develops and disseminates health and safety information that is accurate, accessible, and actionable. These will promote changes in our hospital here at Brownsville Memorial Hospital to improve health communication and informed decision-making and access to healthcare services for our patients. So again, health literacy is the ability to receive, understand, and act on the health information to make an informed healthcare decisions. A person's healthcare literacy may decrease when ill, anxious, or have on some medications. The higher the education, the general literacy does not mean that one is health literate. These all health issues may change the literacy of an individual. So what are some health literacy skills? We have reading, writing, speaking, numeracy, communication, interaction skills, problem solving. So a critical issue regarding health literacy is medication adherence. The 38% of adults with literacy skills at the 9th grade or above misunderstood dosage information or instructions from common medications. Majority of patients misinterpreted all warning labels with the exception of take with food. Example of an error that occurs is for external use only, and the patient thought it meant take only if needed. So even well-educated adults don't know common healthcare terms and concepts. For instance, some terms that are often misunderstood are orally, applied locally, hypertension, cancer terms such as screening, polyps, lesions, colon, mammogram, digital rectal exam, and then some consent forms in terms such as placebo, efficacy, random, and IRB. So the cost for poor medication adherence is huge for healthcare. Healthcare costs total in the United States is estimated between $106 and $238 billion annually. This accounts for about 7 to 17% of all personal expenditures. The future cost of low health literacy ranges from $1.6 to $3.6 trillion. And then savings by improving health literacy would ensure all those who are uninsured currently. Reasons for the high healthcare cost for poor medication adherence include longer hospital stays, 6% more hospitalizations, 1.5 times more likely to visit a doctor, more medication and treatment errors, 3 times as many prescription drugs, and the lack needed of skills to negotiate healthcare system. So patient education, what we know, written materials when used alone will not adequately inform. Patients need other methods to get the information to them. Patients prefer receiving key messages from their clinician with accompanying pamphlets. Focus needs to be on needs to know and needs to do. And then patients with low literacy tend to ask few questions because they don't know the right questions to ask, because they don't understand what is being explained to them. So we need to talk. Don't be afraid to speak honestly with your physician. Communication problems typically stem from the following. Patients are afraid to ask questions. Patients don't know when to ask questions. And patients view it as disrespectful, unwise to question their physicians. So these are old myths. Patients were taught never to second guess their physicians, and we want patients to be part of their care team, and that means being interactive and being able to make some decisions on how they what care they receive. So a great method to improve health literacy is using the teach-back method. All healthcare providers can use this. It's simply asking patients to repeat in their own words what they need to do in a caring manner. It's not a test of the patient. It's a test of how well you explained it to the patient. It's a chance to verify the understanding. If necessary, re-explain the information to your patient again and check again. A research-based health literacy intervention that improves patient communication and patient health outcomes. So who can use the teach-back method? As I just explained, any member of the healthcare team, from nurses, physicians, pharmacists, technicians, medical assistants, receptionists, dietitians, anybody with who is explaining information to a patient can use this method. In just some of the statistics of the teach-back method, studies indicate that 40 to 80% of medical information patients receive is forgotten immediately. So if you don't use, if you give this information to a patient, as soon as you leave the room, the information is gone. Nearly half of information is retained incorrectly. Patients with diabetes whose healthcare providers use teach-back technique demonstrated significantly better diabetes control. And then patients using inhalers in the feedback with their healthcare providers use their inhaler correctly over 80% of the time. So this reduces hospitalizations and other primary and urgent care appointments. So teach-back method, you want to start slowly. Plan your approach. How will you ask your patient to teach back based on the topic you are reviewing? Use handouts. A lot of patients love handouts, a pamphlet or pictures of the medications they're going to be taking. Review and written materials can reinforce key points and help increase patient understanding. For more than one concept, chunk and check. So this means to teach the 2 to 3 main points, check for understanding, and then move on to the next concept. Again, you want to clarify and then practice. So as with anything you do, if you don't use it, you will lose it. So you want to do this with all your patients. Here we're going to show you a little video of an interaction between a nurse and a patient on some medication.
Ibuprofen for your leg pain.
Okay, so we just saw an interaction between the nurse and a patient using the teach-back method. So now we are going to break into some small group teams, and we're going to learn and we're going to practice on the teach-back. So in this exercise, you will divide it into small groups of 3 members. Each member in the group will play all the different roles. The roles include the patient, who is going to be receiving the information on a new diabetes medication, the healthcare provider, explaining to the patient about the new medication, and then the observer who will observe the interaction between the patient and the healthcare staff member. So each round will last about 5 minutes. At the end of each round, the group members will rotate to a different role until all the various roles have been played. So the areas to cover during this training exercise, during this exercise, it is the healthcare staff member's goal to help the patient to remember how and when to take the new medication, ensure that all medications or all questions pertaining to the medication and other health concerns are being asked and answered by the patient. So the materials that you will be needed for this exercise are the scenario, 3-person team, pen and paper, and the patient medication summary. So the scenario, Mrs. Miller, or Mr. Miller if you are a male, was brought into the emergency room after suffering a hypoglycemic episode. She is a 54-year-old overweight woman who has type 2 diabetes for 3 years. She has a history of poor blood glucose control. Mrs. Miller is being discharged home on metformin 500 milligrams 2 times a day with morning and evening meals. This is her current medication. She's taking lisinopril, levothyroxine, regular insulin, and gabapentin. So the group activity, the provider, as the healthcare provider giving instructions to the patient, you will be responsible to explain how the medication should be taken, explain when the medication should be taken, and with what other medications that the patient is currently on, confirm the patient's understanding, and then encourage the patient to ask questions. As the patient, you will be receiving the instructions from the healthcare provider, and you will be responsible to listen to the instructions the provider is giving you, interact with the provider the way you would imagine a patient in this situation would. The more real, the better the experience. And lastly, the observer. As the observer, you will watch and evaluate the patient and the provider interaction, and will be responsible to identify any medical non-plain language that is being used during the conversation, identify any confusion that is noted by the provider or the patient, evaluate how well the provider used the teach-back method, and evaluate how well the provider was able to get the patient to ask questions. So as we just wrapped up our final our group exercise, now we will take some time to just debrief and hear about what we learned. So what was the difference from the usual, what you usually do, and explaining things to your patients? What was it hard to use during plain language? Was thinking of a way to clarify something to the patient did not work, understand, difficult? Was it difficult to get the patient to ask questions? And what did you learn from this exercise? So there's always a debrief that we're going to have. So these are the things that we'll discuss after the 15 minutes. So in conclusion, here's just some strategies for health literacy. Appreciate why communication can be hard for patients. Patients can find it difficult to participate in health conversations. They may feel fear or ashamed to admit that they didn't know how or know the terms or suggestions. It's always challenging when you're working with patients. Honor the patient's experience. The patients ultimately are the experts. They live with this disease every day. Acknowledge articles and printouts patients may bring. You know, what you want to do is just make sure you let them know about the biases that information is, and then confirm that you and your patient understand each other. Help patients learn more. Give them some other information. So in conclusion, we must remember that communication is the most important part of what we do with our patients. If we fail to communicate with our patients effectively, both parties fail. Although we believe we provide adequate health information in understandable terms, it may be necessary